Park Chamber of Commerce, and we're pleased to have you all with us this morning for our webinar, Fear and Loathing in Quarantine, Understanding the Latest COVID-19 Federal Laws. This is certainly an important topic, one which has changed the legal landscape for all businesses very rapidly. We have nearly 400 of you on the call today, demonstrating the necessity for clarity on these issues. We appreciate you joining us. We're very excited to learn from the team at Foulston Siefkin, who are longtime supporters of the Chamber, and we'll introduce all of them in a moment. First, some housekeeping items. All attendees are automatically muted. We'll have presentations from each of the panelists first and then have Q&A following. Please use the Q&A feature at the bottom of your screen to submit any questions you may have during the presentations. In your controls at the bottom window, click Q&A. If you're on a mobile device, tap Participants, then Q&A. The window will open on the right side of your screen if you're not in full screen mode, and you can type your message into the window and press Enter to send your message. We are recording this session, so you can listen later or share with friends who missed the session today. Now on to our webinar. Our moderator is Tony Rupp, partner in charge of Foulston Siefkin's Kansas City practice. Tony is an experienced litigator representing both corporate and public entities. He also serves on the Overland Park Chamber's Executive Committee and chairs our public policy efforts. Tony will introduce our panelists and moderate the questions at the end. Tony?
Thank you, Tracy, and thank you to the Overland Park Chamber for inviting our firm to co-sponsor this event and to provide the content. As a starting point, my hope is that you and your employees and families are healthy in these trying times. And my further hope is that you're able to weather the economic challenges caused by all of this. As Tracy indicated, I'm active in the Chamber, and the Chamber's mission is to help Overland Park prosper. And it is with that goal in mind that we present this program today. Many of you saw that our colleague Tara Eberlein was going to be one of the speakers today, and she's a great speaker, and I feel bad that she's unable to join us, but she fell a little bit under the weather yesterday, and we have a capable replacement in Vaughn Burkholder to talk about personnel and employment issues. As Tracy indicated, the order of our presentation will be that we will talk about business topics first. Andy Nolan will be talking about that. Then we will talk about personnel issues. Vaughn will talk about that. And then we'll talk about healthcare topics, and Alex Schulte will talk about that. We will wait until the end to do the questions. We will have a question and answer period. I know that question and answer period is very important to each of you. We have started receiving questions. Celia with the Chamber received questions in advance via email from a number of you. With 380 of you on the call, it is unlikely that we are going to get to everyone's questions. When I begin, I will kind of sift through those questions and choose which ones to ask the panelists, and I've asked them to try to limit their answers to any one question to about 1 minute, so that we can get as many questions answered as is possible. In terms of the questions that are asked, because we have so many people on board on this call, I'm going to try to choose those questions that are most broadly applicable to the largest number of folks in choosing which questions I ask the panelists from those that you submit. Our first speaker is Andy Nolan. Andy leads the firm's taxation practice group and represents our clients in business deals and tax issues. He received his undergraduate and law degree from the University of Kansas, where he served as editor of the Law Review, and he has an LLM in taxation from NYU. And with that, Andy, I'm going to turn it over to you.
Great. Thanks, Tony. Thanks for your interest in the topic, and thanks for being here today. My job is to talk about some of the key business issues that arise from the CARES Act, which was enacted by Congress and signed by President Trump on last Friday, the 27th of March. I'm sure the reason many of you are here is to talk about the Paycheck Protection Loans program, which has been probably the thing I've spent more time on the phone talking to folks about over the last few days than anything else we're dealing with right now. It certainly, from a business standpoint, is the most talked about aspect of the CARES Act. What many people don't realize is that it's actually an expansion of an existing Small Business Administration loan program, Section 7A loans. The expansion runs through June 30th of this year. Frankly, there are $349 billion that are allocated to fund these loans. We expect those funds to be allocated prior to that time. The big changes that it makes to the existing loan program is that it allows for deferred payments. In the act itself, it said between 6 and 12 months. The government actually just came out with guidance 2 days ago when they released the loan applications, and we know that deferral is actually going to be 6 months and not longer than that. In addition, before the CARES Act, to determine whether someone was a small business, you had to either look at their size, so the number of employees, or the receipts of the business. So there was, in essence, an income test, and that income test has been removed. So let's jump into the Paycheck Protection Loans. First question, of course, everybody wants to know who's eligible. And small businesses of many types are eligible. For-profit businesses, 501c3s, this generally is public charities, religious organizations, certain veterans organizations, and certain tribal organizations. One of the catches that some small businesses have found themselves in is that you did have to be operating on February 15th of this year in order to qualify. So this is an issue that is going to hit some people. Say, for example, I purchased a new business, I purchased an ongoing business, but I didn't close until March 1st. Am I going to qualify? The good news to you is that because this is an expansion of existing SBA 7A loans, there may be some relief for you under some of the regulations that exist, but it's a hurdle. Then the other piece, that's applicable here is that you've got to have an employee count of 500 employees or less as a general rule. And when you're counting for 500, you count full-time and part-time employees as a head. So it says basically you look at everyone that's a full-time employee, a part-time employee, or otherwise employed, and each one takes up one of those spaces. Now, if you say, hey, I've got more than 500, am I automatically out? The answer is maybe not. So if the SBA has a table of small business size standards, if you Google that, you'll be able to find the table. And depending on the industry that you're involved in, even if you have more than 500 employees, you may be able to qualify. There's a specific exception in the Act itself that says businesses that are in food and hospitality businesses and don't have more than 500 employees in any particular location can just skip right out of those affiliation rules. The next question everybody wants to know is, how much can I borrow? And the Act sets this out, and it's basically your average monthly payroll cost times 2.5. The way they wrote the instructions for the loan is a little bit confusing, but it actually still gets to this same result. There are special rules that apply to businesses that didn't exist on February 15 of last year, and also special rules for seasonal businesses. And so if you fall in one of those categories, you probably ought to get a little bit of advice. So what are payroll costs? So they're your salaries and your other wages. It's your paid time off, so vacation pay, sick and family leave pay that you give to employees, separation payments that you made to employees, the employer's share of health insurance costs, and the employer's contribution to a retirement plan, and then state income taxes paid by the employer on employee income. And so so when you think about payroll costs, don't just look at, oh, here's the amount of my payroll. Think about what else goes into it. The one thing that some people would have expected to be in there that's not is your payments of the employer's share of withholding taxes is not a part of payroll costs for purposes of making this calculation. Also, you need to know that wages you pay to someone in excess of $100,000 are not included. So then I know I can borrow. What can I use the loan proceeds for? Payroll costs, those same costs, that same list of costs that we just talked about in determining what your payroll costs are, you can use the loan proceeds to pay those. You can use the loan proceeds to pay rent on your business location. You can use the loan proceeds to pay a mortgage interest payment, not principal, but interest payment on a business property, and you can use it to pay your utilities. Now, one thing I will tell you that in guidance the SBA gave when they issued the loan applications, in terms of thinking about what can be forgiven, and we'll talk about that on the next slide, they did say that they really expect to only forgive about 25% of total costs that are anything other than these payroll costs. So that is the big question. And so I can get a loan for 2.5 times my average monthly payroll cost, but how much of that's going to be forgiven? Because the big draw here is, of course, that in many respects, this feels like free money. So I get a loan for 2.5 or 2.5 times my monthly payroll, average payroll, but then the government's going to forgive a fair chunk of that. And here's what they're going to forgive. So it's amounts that you spend on those payroll costs, that list we talked about, amounts you spend on mortgage interest, not principal, rent, and utilities. Those payments have to be incurred for things that were incurred after February 15 of 2020. The obligations have to be incurred, and they have to be paid in the 8-week period that follows the loan origination date. There is some indication from the SBA that we may get a little bit of wiggle room on that, but the Act says basically take the day the loan proceeds are dispersed to you, look at the next 8 weeks, and that's the period that the forgiveness relates to. And in terms of calculating your payroll costs, again, payroll to the extent an employee is making more than $100,000 on an annualized basis, payroll expenses that are above that $100,000 cap aren't going to count for forgiveness. So there are some limitations on what's going to be forgiven, because the purpose of forgiveness is really to keep employees on your payroll and off of unemployment or without a job. And so it really is, the purpose of this program is to incentivize employers to keep employees on their payroll. And so if you decrease your head count, and we'll walk through that a little bit, then the amount that you're going to be, or that's going to be forgiven of your loan, is going to be reduced. And it's basically a fraction. So for the 8 weeks after you get the loan, again, so when the loan's dispersed in the next 8 weeks, you're going to look at your average full-time employee count over that 8-week period. And then the denominator is going to be one of two things, and you get to choose which denominator you use. So it's either your average FTEs or full-time equivalent employees between February 19 and June 30th of 2019. So February 15 to June 30 of last year, or your average FTE count from January 1 of this year through February 29 of this year. You get to choose, but it's going to be a proportionate reduction. So if, for example, you had 100 employees during the period from February 15 to 2019, and during the period or during the 8 weeks after loan disbursement, you have 80, then only 80% of your loan that was spent on forgivable amounts is actually going to be forgiven. So there's going to be a reduction. In addition, if you decrease compensation above certain thresholds, for employees, then you're on a dollar for dollar basis, you're going to have a reduction in the amount of forgiveness. So it says basically you look at every employee who makes $100,000 or less, and to the extent that during the 8-week period, they are paid either 25%, more than 25% less, then you're going to, in comparison to the last full quarter that the person was employed, then on a dollar for dollar basis, you're going to reduce the amount that can be forgiven. There are some exceptions for this reduction for certain rehires. The thing that's not hazy about this, I say on my slide here that the details are hazy. What's not hazy is that it has to happen by June 30th. What's not clear is the extent to which you have to make the employee whole or make their wages or completely restore their wages. But we think that's the answer. We frankly expect a lot more guidance from the government on this forgiveness aspect in the coming weeks. So what are the loan terms? The Act actually permitted the loan to go for as long as 10 years, but when the SBA put out its guidance 2 days ago and put out the loan applications, they said the deferral is going to be for, the loan term will be for 2 years. It'll be at a 0.5% fixed rate, and the first payment is going to be deferred for 6 months. And so to the extent that you take out a loan, it's not forgiven, the remaining balance, any portion of it that's not forgiven is going to be subject to these terms. When you take the loan out and apply for the loan, there are no borrower fees. If you have a loan balance remaining and you have cash to pay it, you can prepay it at any time. There are no penalties associated with that. There are no personal guarantees, and there is no collateral requirement. There's also not a requirement generally for an SBA loan under this program. You have to show that you're unable to borrow money elsewhere. They've removed that requirement for purposes of this program. One other big item is, so typically if a portion of my loan is forgiven, I'm going to have income equal to that amount. We call it discharge of indebtedness income. But Congress specifically provided that no income tax will arise from any loan forgiveness. When can I get a loan? It actually starts tomorrow. For small businesses and sole proprietorships, you can apply through existing SBA lenders. Starting a week from tomorrow, independent contractors and self-employed folks can apply also through existing SBA lenders. The SBA or Treasury is actually working to expand the pipeline to get in other folks who aren't traditional SBA lenders. But as of today, you really need to find your local friendly SBA lender. That's how you're going to get your loan processed fastest at this point. There are a couple of other things that I want to talk about that aren't related to Paycheck Protection that came out in conjunction with the CARES Act that I think are important, especially if you're not going to pursue the payroll protection plan loan. So the first is the employee retention or payroll tax credit. It's a credit of up to $5,000 per employee. Your credit is equal to 50% of the wages that were paid by a qualified employer to its employees during the COVID-19 crisis. To qualify, you either have to show, so to be a qualified employer, you either have to show that your operations were suspended in full or in part because of COVID-19. So for example, because of a shutdown order, or you have to see a fall in your gross receipts by more than 50% when you compare it to the same quarter in 2019. If you're an employer who has more than 100 employees, then you're limited to a credit against your wages that are paid to people who aren't working due to the shutdown or slowdown. If you have fewer than 100 employees, it's basically all of the wages that you pay during that period, not just wages paid to people who aren't working. Very importantly, if you get a loan under the Payroll Protection Program, sorry, this slide is wrong. You cannot, the word not is missing from that. You cannot receive the employee retention credit. That's an important distinction to know. relief that I wanted, or a second additional piece of relief that I wanted to mention, is the deferral date for certain employment taxes for 2020. So the CARES Act provides that employers can delay paying the employers, but not the employees' portion of Social Security taxes. So basically 6.2% of their wages. A self-employed person can delay paying 1/2 of the Social Security portion of their self-employment taxes, to the extent that those taxes relate to periods from March 27, so last Friday when the CARES Act was signed, to January 1 of 2021. Those deferred taxes can then be paid over the next 2 years, with half being due December 31 of next year and the balance due December 31 of 2022. But again, very important to note, if you get a payroll protection plan loan, you're not qualified for this deferral. So you'll still need to pay those employment taxes on time. So those are the key business aspects of the CARES Act. And we're going to move on to the key personnel issues.
Thank you, Andy. I'm going to defer the questions, obviously, until the end, but there is one question that Gus Meyer asked that I will answer right now. And his question was, would we be able to get copies of these slides? Andy did note an important knot that we need to add to one of the slides, so we will make that edit, and then we'll work with the chamber to make sure these are available, whether we send them out to you or whether the chamber otherwise makes them available. We will make sure that we are able to get these slides to you after we've made that one edit. In terms of personnel issues, obviously you as employers are dealing with a myriad of personnel issues, from furloughs to unemployment benefits to the Family First Coronavirus Response Act. Vaughn Burkholder deals with personnel issues as the head of our employment team here in Overland Park. There are a number of really fine law schools. Vaughn went to Creighton University, which happens to be my preferred choice for great law schools. So in any case, Vaughn, it's to you now.
All right, thank you. It's a pleasure to be with you this morning. I send Tara's regrets that she's not able to be here. I'm going to be talking about a couple of different federal enactments that have recently been passed. One of them is the CARES Act that Andy already mentioned, the Coronavirus Aid, Relief, and Economic Securities Act, and it essentially expands state unemployment benefits. Of course, the CARES Act has been passed about a week or so ago, and we've been trying to figure out what it means. The Department of Labor promised that regulations would be issued, clarifying some of the provisions of the act, and just yesterday, about noon or so, we received those regulations. I'm holding up so that you can see. I don't know if you can tell the width. It's about an inch worth of material that I printed off, 124 pages, of which the first 80-some pages are the preamble, followed by 40 pages of actual regulations. So those of us in our office that practice in this area are trying to digest all of this so that we can advise clients moving forward. The expanded state unemployment benefits under the CARES Act applies to individuals who would have been, even without the coronavirus pandemic occurring, would have been eligible for unemployment benefits. But what it does essentially is to add an additional $600 per week to whatever benefit the employee would otherwise be entitled to, starting with yesterday, April 1st, the date that the act goes into effect, and running through July 31st of this year. Now, here in Kansas, the maximum weekly benefit that an employee without the benefit of the CARES Act could recover would be $488 a week. And so we're talking about making that figure $1,088 a week with the, I'll call it an additional amount under the CARES Act. So it's more than doubling the maximum weekly benefit, but actually the real benefit comes to those folks who are not receiving maximum amount, but rather something closer to the minimum, which is only $122 a week. And those folks will also receive that $600 additional amount, which is in essence a 500% increase over what they would otherwise receive. The other thing that the expansion does is that it expands Kansas regular unemployment coverage from 26 weeks, or in essence 6 months, to 39 weeks, or 9 months. Now, not that entire time period will receive this $600 increase. That $600 increase essentially runs out on July 31st, at least under this act. Of course, there are discussions at the federal level about additional enactments, additional stimulus, additional benefit to employers and employees. And so there's a possibility that that time period might be increased, but July 31st is the cutoff date currently. The other thing it does is incentivizes all of the states in the country to waive the 1 week waiting period if they have one. Kansas typically does have one, but Kansas has elected to waive that 1 week period. And so employees can now start receiving their unemployments effective day one of their period of unemployment, and it will include that $600 additional amount. All right. Additionally, under the CARES Act, there is a provision known as the Pandemic Unemployment Assistance, and it does a number of things. The first thing it does is it opens up unemployment benefits to individuals who traditionally would not receive them. For example, self-employed folks, independent contractors, and what we call gig workers, like Lyft employees or Uber employees. All of those folks previously would not be eligible for unemployment benefits, but now at least they have some eligibility. They have to certify that they're unemployed or partially unemployed, and that they're unable to work because of certain qualifying reasons. Now, I'm not going to go into the qualifying reasons. There are 9 of them, but I will simply point out that all of those reasons have to be related to COVID-19. For example, the self-employed person themselves has COVID-19, or they're caring for someone with COVID-19, or for some reason, even though they may not have COVID-19, there may be some reason why they cannot carry on their self-employment or their independent contractor work because of COVID-19. So I won't detail all of those, but they all relate to COVID-19. Now, individuals who can have the ability to telework or are receiving paid sick leave or other type of paid leave benefits are not going to be eligible for this pandemic unemployment assistance. So that is an exception to it. The benefit amount, basically, it's the same benefit that you would receive under traditional unemployment. Again, in Kansas, from $122 to $488 a week, plus, again, the additional $600 per week. And again, the benefits are available up to 39 weeks rather than the typical 26 weeks under Kansas law, but the $600 per week does run out effective July 31st. The next thing we're going to discuss under the CARES Act are shared work programs. This is my Marco Rubio moment where I take a little sip of water. Some of you may already be aware that the Kansas unemployment system, and Missouri for that matter, contains a shared work program, but it's particularly being highlighted under the CARES Act. Instead of actually laying off an employee or a number of employees for a temporary period of time or even a permanent period of time, this does allow an employer to set up a program or a plan whereby a certain number of employees can work partial weeks and receive partial unemployment benefits. The criteria in Kansas I have listed here in the bullet points. It's got to affect at least 2 or more employees within a unit. The unit is defined as a specific department or shift or other unit of the company, unit of 2 or more employees that are designated by the employer to participate in the plan. It only applies to a reduction in hours and wages within a band of 20% to 40%. So if you are reducing an employee's hours and wages by 15%, you don't qualify. Or by 45%, you don't qualify. It's got to be within that 20 to 40% sweet spot. You've got to have at least 10% of employees in the affected unit. to be eligible, and the plan must describe how the fringe benefits are going to be handled for the employee. If you are interested in this, you can simply go to the Department of Labor unemployment section of the website for Kansas. What I did was I simply Googled shared work program, or not Googled, but searched shared work program or shared work plan, and it will take you to a page that describes, again, these elements. It has an application for how you go about as an employer applying for this. Up until the present time, recently, the turnaround time for those applications has been about 2 to 3 days in our experience. I would expect that that's going to be adversely affected now that the CARES program has gone into effect. So I would expect it's probably going to take a little more than 2 to 3 days to turn that around. One benefit to the employees is that if the employer gets approved under the shared work program, the employee does not have to make a separate application for unemployment benefits. They are simply logged into the program through the employer's application. Now we're going to switch from the CARES Act to the Families First Coronavirus Response Act, called the FFCRA for short. Sometimes we just call it Families First. It also was effective yesterday, just like the CARES Act. It applies to employers with under 500 employees. And it provides that such employers with under 500 employees has to provide 2 new additional forms of emergency paid sick leave that were not previously available until this act was passed. I'm going to go into some detail, but in essence, the 2 are, first of all, 2 weeks of paid sick leave, again, for conditions related to COVID-19, either isolation, illness, care of others, or child care responsibilities due to COVID-19. And we're going to talk about that in more detail here in a moment. But the other type is emergency FMLA leave to care for a child who cannot go to school or participate in daycare, again, because of COVID-19. So let's talk a little bit more about the paid sick leave provision. It's 2 weeks of emergency paid sick leave if the employee can either work in a traditional work setting or telework because of any of the following. And this is not separated by and. Each of these bullet points are alternative ways of becoming eligible as an employee for these 2 weeks of paid sick leave. The first is that they're subject to a federal, state, or local quarantine or isolation order. One of the things that was clarified, we believe, by the regulations is that it's not simply the type of order that Governor Kelly issued last week, or that we had in some counties and municipalities even before that. It has to be more specific than that generalized quarantine or stay-at-home order. The second way of qualifying is that if the employee has been advised by a health care provider to self-quarantine due to concerns related to COVID-19. One of the things, again, that we wondered about before the regulations were issued, but we now know, is that employees do not have to provide the employer with an actual written note signed by a healthcare provider. They can simply, the employee can simply tell you as an employer that you have been told, that they have been told by a healthcare provider that they need to self-quarantine. So you cannot require them to actually provide you with a document from their physician or a nurse assistant or something of that sort. The third is that the employee is experiencing symptoms of COVID-19 and is also seeking a medical diagnosis. The fourth is that the employee is caring for an individual who's subject to a quarantine order or direction to self-quarantine. And again, it has to be something more specific than the one that generally applies to all of us. The employee is caring for a son or daughter if the child's school or care provider is closed due to COVID-19. And then finally, if the employee is experiencing any substantially similar conditions specified by the Secretary of HHS. And that's basically just a catch-all provision so that if at any point in time the Secretary deems that an additional bullet point qualifying an employee for the 2 weeks of emergency paid sick leave is appropriate, it can be issued, and you as an employer would have to honor that. All right, the emergency family and medical leave that we're talking about now under the new Families First Act is paid. Now that's a change from what you as an employer have experienced in the past. FMLA has never been paid leave up until April 1st. Now it can be paid and will be paid if employees qualify under this particular provision. It can provide up to an additional 10 weeks of family and medical leave. Now that 10 weeks, as everyone I think knows, that FMLA traditionally covers up to 12 weeks during any 12-month time period, and it's unpaid typically in the past. Now 10 of those 12 weeks, not an additional 10 weeks added to the 12. So it's not a total of 22 weeks, it's only 10 of the 12 weeks an employee can be eligible for leave under that if they're unable to work due to the need for leave to care for, and it's basically related to child care, a child whose school or child care provider is closed or unavailable due to COVID-19. So it's not all the different types of FMLA that are available under traditional FMLA. It's only this particular type that allows you to get those 10 weeks. I should have mentioned that with regard to the emergency paid sick leave, there is no minimum period of employment for the emergency paid sick leave. If an employee went to work for you on April 1st and by the afternoon of April 1st, they qualified for emergency paid sick leave for that 2 weeks that we were just talking about, that's fine. As long as they're employed by you for 1 hour, 1 minute, 1 day, no minimum period of time, they get those 2 weeks. For this emergency FMLA, they have to have been employed by you for at least 30 days. Now there's a bridging provision that provides if you laid them off and then brought them back and you add those two together and it totals at least 30 days, they're qualified. And of course, with regard to almost all of these provisions we're talking about, there are exceptions. There are details that may change the provision, but this is basically a high-level review of what these laws provide. There's a payment, as I mentioned, under this form of FMLA. It's 2/3 of their regular pay, capped at $200 a day or $10,000 total during that maximum 10-week time period. And once again, I'll point out that it doesn't entitle an employee to an additional 10 weeks beyond the 12 under traditional FMLA. It just is a way of getting up to 10 weeks out of the usual 12. All right. Other issues under Family First, intermittent leave. Those of you who have dealt with FMLA in the past know that it isn't always just continuous leave. Sometimes it can be intermittent. Intermittent leave is also allowed under this particular provision of the Families First Act. Different rules for telework versus the usual work site. I'm not going to delve into those here, but one of the things to bear in mind that intermittent leave under this emergency FMLA must be agreed upon by the employer and the employee, which is different than traditional FMLA, in which an employee who is eligible for FMLA can take it whether the employee wants them to or, the employer wants them to or not. In this instance, the employer has to agree to the intermittent leave. Covered employers are eligible for dollar reimbursement through tax credits. Of course, that means you have to front the money for this emergency FMLA, but you will eventually get it back in the form of tax credits. Some appropriate documentation is required. As I said, you don't have to or you cannot require the employee to provide a written doctor's note, but there is some documentation required in the form of certifications and such. All right. Next thing we're going to talk about is the exemptions to these provisions. And there are two different exemptions. The first is the healthcare provider exemption. A healthcare provider is defined under the Families First Act, and I have it in the first bullet point there, very broadly. Anyone employed at a doctor's office, hospital, healthcare center, etc., or any facility that performs laboratory or medical testing, pharmacy, or any other similar institution, employer, or entity. So it's extremely broad who is a healthcare provider. And bear in mind that when we talk about a healthcare provider, we're not talking about the employer, we're talking about an employee of the employer. But by this broad definition, it's our opinion in this office that any employee who is a healthcare provider that works for one of these entities, then basically all of the employees of that company are subject to this exemption. It also covers not only actual employees, it covers employees of an entity that supports by providing services or maintaining operations of an employer that employs healthcare providers. So it's extremely broad. Now, let me point out that simply because you may be an employer that does employ healthcare providers, and therefore all of your employees are eligible for this exemption, it doesn't mean that you can't grant this exemption to some employees if you feel as though it's appropriate. But certainly all of the employees can be exempt. And then the other exemption is the small business exemption, and that's for employers who have less than 50 employees. So if you have somewhere between 1 and 49 employees, you may be eligible for this exemption from either the emergency paid sick leave or the emergency FMLA. But it's not just so simple as, well, I've got 49 employees or I've got 30 employees, therefore I don't have to comply. You still have to meet some requirements, and they aren't particularly generous. The leave that you can exempt from has to be requested because of the child's school or daycare is closed. And in addition, an authorized officer of this small business has to basically certify that either allowing this employee or the number of employees who have requested it is going to result in the expenses exceeding revenues, or they have to, in essence, certify that absence of this employee or employees is going to entail a substantial risk to the financial health or operational capacities of the business, or that allowing this person or these people who are otherwise entitled to this leave will result in the company not having sufficient workers able to keep the business open at a minimal capacity. So it's not simply enough to say I've got 49 employees, I don't have to give people this leave. You have to meet one of these other requirements that I just pointed out, and the leave has to be related to the school or daycare being closed. Those, again, very high-level review of the Families First Act and the CARES Act, but that hopefully will give you at least some idea of the new laws and the possibility that you may be exempted in some circumstances. Tony, back to you.
There we go. Thank you very much, Vaughn. And we are receiving a number of really excellent questions, and I look forward to chatting with the panelists about those after we finish Alex's presentation here. Alex Schulte is a healthcare lawyer, partner in our firm. He is obtained his undergraduate degree at the University of Missouri and his law degree at the University of Iowa. And he counsels with healthcare providers on a regular basis. And he's going to talk about the key healthcare issues. After he's done that, we'll get to your questions.
For tuning in today. I want to say at the outset that there's been a lot of regulatory changes in rulemaking by CMS and the Office of Civil Rights and several other agencies that are very significant and worth discussing. But today, like the other panelists, I'm really focused on the statutory changes, in particular the FFCRA and I guess most significantly the CARES Act. For the purposes of analyzing these two statutes, I think it's helpful to break them down into sort of 5 categories. And these are massive statutes, so this is admittedly kind of an oversimplification. But one thing in particular in the CARES Act, there was a lot of improvements to public health infrastructure, which we'll briefly discuss. The FFCRA had a number of provisions about coverage of COVID-19 related services, particularly testing and ultimately vaccinations, which obviously we don't have yet. there's a number of telehealth initiatives, which I think could ultimately be very important even after this crisis ends, the effect of some of the telehealth changes in these statutes. And then I broke the support, the financial and other support, into two kind of categories: support for providers, specifically providers who are facing this COVID-19 crisis on a regular basis. I mean, they're treating a number of COVID-19 patients right now, which obviously, depending on the part of the country you are, the levels of outbreak are significantly vary. And then there's some other financial assistance that applies to a broad range of providers, regardless of the geographic location or the number of COVID-19 cases that they've treated, or potential COVID-19 cases. So if we could start out with improvements to the public health infrastructure. It's no secret that the American public health infrastructure has been strained and tested by this outbreak. There's a number of provisions in the CARES Act to try to address that, assessment of the American system's dependence on devices, drugs that are manufactured abroad, the supply chain. There's particularly some requirements in the CARES Act that pharmaceutical companies that manufacture what are deemed to be essential drugs, critical drugs, have their supply chain assessed, and they have emergency preparedness plans. There's also a buildup of the National Strategic Stockpile, which is something that you see quite a bit of on the news also, and an initiative to add protective equipment and other essential supplies to that stockpile. They've also implemented new and more flexible rules for the for over-the-counter drug approvals, which if you read the healthcare sections of the CARES Act, which I wouldn't necessarily recommend, but if you read through it, there's this big section, in this time of crisis, and all these essential provisions to try to mitigate the crisis. And there's these provisions about over-the-counter drugs, and in particular there's several pages dedicated to sunscreen ingredients, and you kind of wonder why that needed to be in this emergency statute. But I've been told that that's all very necessary. But anyway, so there's significant changes. There's also significant funding for community health centers and other local government projects. And there's state and local projects in response to COVID-19. There's a $150 billion fund. That's not just public health infrastructure, but I assume we'll see some public health initiatives that are part of that spending. And so if you go to the next slide here, the FFCRA has a number of provisions about COVID-19 coverage for COVID-19 services, and the CARES Act followed up with those. Private insurers must provide coverage and no cost sharing, no deductibles, copays, etc., for COVID-19 testing itself, services related to COVID-19 testing, and then items and services that prevent or mitigate COVID-19. We're really talking about vaccines. The same is true for government payers, Medicare, Medicaid. They must cover without cost sharing COVID-19 testing. And then for Medicare and Medicaid, Medicare and Medicare Advantage, they're also required to cover a vaccine without cost sharing. And this is a new feature of the CARES Act, is that providers must publicly disclose the cash price of their testing for the COVID-19. On the next slide, if I could get that next slide. Telehealth provision. So I mentioned this earlier. There's a lot of Medicare historically has been pretty stingy as to what telehealth services they will pay for. And that's been one of the big inhibitors to the growth and development of telehealth in this country. But during this time of emergency, they've significantly loosened Medicare requirements. There was a requirement that the originating site, which is the site in which the patient is located, would need to be some kind of healthcare facility, and that the rule that the patient would be located in a rural area or certain other kinds of underserved areas. But those, at least for the period of this emergency, those limitations have been removed. And there's also no need for a pre-existing patient relationship, which was previously a requirement in emergency situations, that the physician would have seen the patient within the last 3 years. That's been eliminated from the statute. They've also suspended certain requirements of face-to-face visits for specifically for home health dialysis patients and hospice patients, allowing more of that kind of certification of the necessity of services to be done through telemedicine. And on the next slide, I have a couple more quick points on the high deductible. Typically, a high deductible plan would be required to charge some kind of a deductible, at least until the deductible is met, for telehealth services. But the CARES Act suspended that. There's a bunch of additional grants to support telehealth initiatives. And the HHS secretary is expressly ordered to consider other uses of telehealth medicine and encourage other uses of telehealth. This has been kind of a dramatic reversal in, I guess, the government's attitude towards telehealth for obvious reasons. And we certainly, I think a lot of providers hope it'll continue after the crisis period ends. On the next slide, I mentioned that there's some significant support for COVID-19 providers. This is an emergency. There was an emergency fund of $100 billion that was established through the CARES Act. That's about $108,000 per hospital bed in the United States. When I saw that number, I thought that it couldn't be true, or that couldn't be quite correct. And I ran the calculations myself, and it appears that it is basically correct, although the number of hospital beds is a little hard to pin down, but that's close to being correct, which, kind of goes to show you how it's hard to even wrap our head around the enormity of the amount of money involved in the CARES Act. But the intent behind this fund is just to get hospitals and other providers to ramp up their capacity really quickly. So this fund can be used for a number of different things. It can be used for buildings, leasing equipment, construction projects, training personnel. It's all about building your capacity really quickly. And if you go to the next slide here, the thing that there's a lot of the questions that remain to be answered about how this grant process is going to work, how HHS is going to administer it. Unlike some other provisions in the CARES Act, it isn't very thoroughly described. The administration and management process isn't very thoroughly described in the statute. So we expect to get some guidance from HHS soon about that. And the next slide, I just wanted to note that there's an increase in the inpatient prospective payment systems payments for hospitals who treated COVID-19 patients, about a 20% increase. There's also a provision that limits liability for healthcare volunteers. I should note that this only applies to volunteers who are actually treating and diagnosing COVID-19 patients or suspected COVID-19 patients, and not volunteers that are helping in other parts of a hospital or healthcare provider's operations. And then there's also some changes regarding patient information, which are kind of technical, and I don't want to spend a lot of time on here. As you'll see in the next slide, there's also some significant assistance for providers that are not necessarily based on the number of COVID-19 patients that they're treating. There's a program to provide immediate cash to providers through Medicare advances. This program previously existed in some form, but it's been extended not just to include acute care hospitals that are under the IPPS, but also critical access hospitals, children's hospitals, cancer hospitals. This is up to 100% of Medicare payments for a period of up to 6 months. And that's for all hospitals except for critical access hospitals, which are eligible for up to 125% of payments. And this is essentially a loan against future Medicare receipts. Medicare will not offset or require repayment for the first 120 days after the hospital's first payment. And the hospital won't be required to repay in full until 12 months after the first payment. And this is an optional program. The hospital have to provide to submit a request. Here, I'm going to break from my rule that I'm only talking about the statutory changes, because the day after the CARES Act was implemented, CMS issued guidance extending this to all Medicare participating providers and suppliers, including physician groups, ASCs, and other providers. But most non-hospital providers don't get quite as much relief here, or quite as much help here. It's limited to 3-month payment and only 210 days to repay, as opposed to the 6-month payment and a full year potentially to repay. And my final slide, I just wanted to note that there was sequestration payment cuts, about a 2% cut, that were scheduled to go in effect that will not, or that will not be in effect, I should say, from May 1 to December 31, 2020. So not until 2021. And just generally, the CARES Act authorized and extended a number of important programs that were set to expire in May, and also delayed reductions in disproportionate share payments for providers who treat a higher proportion of uninsured or Medicaid patients. So again, I think I'd make the same disclaimer everyone else made. There's an awful lot in these statutes, and there's been an awful lot of regulatory changes that I wasn't able to cover here with the time we had. But this is at least a good primer on some of the major initiatives and where a lot of this healthcare funding is going in the statute.
Thank you very much, Alex. I'm going to start with Andy. We had several questions submitted in advance, and one question that I guess I would have is, if I'm uncertain whether I need the funds, should I still apply for a PPL loan? And is there any reason a small business would not consider doing such a loan?
As a general rule, Tony, the answer to that is no. I mean, for most businesses, frankly, the payroll protection program loans are what I'd call a no-brainer. There are a few clients or businesses that we've run across who feel like, I kind of have a sufficient amount of cash on hand right now. Do I really want to apply for this? What you have to certify to borrow the funds is just that because of the uncertainty of the current climate, you need the funds. And frankly, we're really advising clients, unless you can assure yourself 100% that you have all the cash on hand you need to weather this crisis that none of us know how long or how deep it's going to cut, I'd apply, and I'd apply soon, frankly, because as we said before, $349 billion was allocated to this, but honestly, we expect it to go very quickly. There's a lot of demand. In fact, Congress is already talking about perhaps allocating more money for this program.
The next question, I think, might be one for both Andy and Vaughn, and it's talking about paid leave, related a little bit to these loans as well. But what if the company cannot afford to pay this leave, or if the doors close prior to the 10 weeks?
I'll let Andy go first.
Andy's muted. If you can,
Oh.
We need to unmute Andy here.
Maybe Andy can't be on. There we go.
There we go.
Unmute myself.
Right.
So I was actually going to say, I think that mostly falls to Vaughn, but so, there's a question about how quickly you can get a loan in place. I mean, obviously these loans contemplate that you get loans for people who are actually on your payroll. Again, there is going to be an opportunity to bring people back and restore benefits. And so it would be possible that, you know, if you had to let someone go in the short term because you couldn't fund it, that if you could get your loan process quickly, get the funds, and then bring them back on your payroll and restore the wages, and as long as you paid what you're going to pay in the 8 weeks after you get the loan, that might be one way to handle that, especially if you have a cash crunch, because sometimes that's the issue. I don't have the cash to do what I need to do.
And Tony's muted now. I think I'm on. Yeah, that's more or less a practical question. If you don't have the cash on hand to pay these emergency leaves and you don't have access to a loan, either one of these SBA loans that the federal government has made available or some other kind of loan, there's not much you can do. As Andy pointed out, there are mechanisms by which you can bring folks back later. But if you're unable to pay this and you don't have access to funds to pay it, and if you're going to go out of business, there's, you know, the old adage, you can't get blood out of a turnip. And so if you're unable to pay these things and you go out of business, I'm not sure what either the government's remedy or any of the employees who feel as though they should have been entitled to these benefits can do about that.
Yeah.
I'll go to one more question that was submitted in advance and then take some of these that are on my screen right now. If I take out a payment protection plan loan, can I still defer paying 2020 employment taxes?
No, those programs are mutually exclusive.
All right. Question, are businesses with an ESOP ownership plan eligible? Andy, that would be for you.
Yeah. So to my knowledge, there's nothing about ESOP ownership that would prevent you from taking out a payroll protection loan program. There's another loan program under the CARES Act as well. They're basically emergency disaster loan programs, and the CARES Act specifically amended the law to allow ESOPs to qualify for those loans. And so I think you should be able to apply.
Another question for Andy. What time frame is the head count applied to? Is it 12/31/2019?
Yeah, so head count is basically looking at, as I understand it, looking at your average employment. There's some confusion about this, and we've even debated this in our own office. So it might be head count as of the day that you take out the loan. It might be head count over basically your average head count over the prior year. There's support for both of those. We don't know the answer. We're telling people take a good faith position, and then we're sorting those out with the lenders. We're dealing with that issue right now.
Another question that was submitted in advance. This is also an Andy question. What defines affiliated groups to combine the company on the employee total? Yeah.
Because the payroll protection program is really just an expansion of existing Section 7A loans, there's actually, there are regulations that the SBA has on this and a bunch of case law. Determining whether a group is affiliated is done on a case-by-case basis, but you're basically looking for, you know, overlapping ownership, overlapping boards of directors, overlapping general partners. Does my business and the other business have a common economic interest? It's a complex question. It's definitely one that you need to get some advice from a lawyer or an accountant on as a general rule if you're trying to determine. If you're thinking about industries that this is an issue for in particular, if you're a private equity company or a portfolio company of a private equity company, you definitely need to be looking at this affiliation issue when you're determining how many employees you have.
It looked like Vaughn had something that he wanted to raise his hand about to further answer that.
Yeah, muted. Great. Although the question wasn't specifically directed to me, I did want to point out that we've had questions from clients of the firm who have, for example, a number of different affiliated companies, none of which have over 500 employees, which, if you remember, is the cutoff for the FFCRA. But if you rolled up several of the companies into one organization, perhaps because of some common ownership, common management, common HR practices, and things like that, then they would have over 500 employees. That is going to be judged by what we in the employment law area call the integrated employer test. And there may be some ramifications of saying, well, either I am or I am not an employer of over 500 employees that can apply to other areas of the law. So even one of the first thing to point out is that the affiliated employer test is not the same test that you would utilize for determining whether you have 500 employees or not for purposes of the FFCRA. And the second point to be made is don't make that decision on whether you want to be covered by the FFCRA or not without considering the other implications of counting yourself as somebody who either has fewer or more than 500 employees, because there may be situations where it cuts against you to go the other way. So as Andy said, contact your lawyer to ask the question as to, so you have a full analysis of how that might impact your company in other areas as well. Thank you.
Next question is also for Vaughn, so we'll keep his microphone open. How does an employer become exempt from the Department of Labor with 50 or with fewer than 50 employees?
Okay, that was already covered. I think that was maybe one of the questions that may have been submitted before I began, or maybe I just didn't do an adequate job of explaining, but I did have that one slide up there that talks about the fact that just simply because you have 49 or less employees doesn't mean you're automatically exempt. It has to be related to child care or school closing because of COVID-19. Let me go to my slide again. All right, thank you. It's got a, basically it has to jeopardize the viability of your company is kind of the generalized concept. There are 3 different bullet points there as to how you can establish that. But it has to be, it has to have an extreme effect on your company to allow these folks to take these kinds of leave before you're entitled to exempt yourself. So again, I would, excuse me, I got a frog in my throat. I would recommend that you contact counsel to give you advice in that area, because it's not as simple as saying, well, I have 49 employees and it's going to be tough on me to comply with these emergency paid leave. It requires more than that.
Some of the questions here are very employer specific. I'm going to try to rephrase them to kind of make them a little bit more broadly based. But in terms of the calculation of 80% not reducing employers by more than 20%, if somebody reduces one employee by 50% but keeps others whole, or is it employee by employee or overall payroll compensation remaining above 80%?
Yeah, this is, I think we're talking about under the payroll protection reduction in the amount that's forgiven because you reduce compensation. And the rules actually say that is not an aggregate test. You don't look at employees or compensation as a whole. It's done on an employee by employee basis.
The next question is also an Andy payroll or Paycheck Protection Act question. Do temporary employees count in the head count, and can their associated expense be included as wages for companies that use temporaries in an attempt to hire type role?
Yeah, we think so, because the Act says for purposes of counting for your 500, for example, that it's any person employed on a full-time, part-time, or any other basis. And so, yes, I think temporary employees would count.
So can employees that are outside the percentage of reduced pay lower than 20% or over 40% file for and collect unemployment due to reduced pay?
Vaughn, I'm looking at you because I don't know anything about unemployment.
Okay, and you're going to have to read the question.
Yeah, can employees that are outside the percentages of reduced pay, lower than 20% or over 40%, file for and collect unemployment due to reduced pay?
Okay, so I'd rephrase the question as saying an employer has applied for and received approval by the state to implement a shared work program because they are not totally laying off, but just reducing somewhere between the 20 and 40% sweet spot. And that's all been approved. So I understand the question then to be, well, what about other employees that are fully laid off? I think it depends on whether they belong to that unit that you defined to the Department of Labor in the state of Kansas, because you have to make certain certifications to the state that you are entering into the shared work program within that unit rather than actually totally laying people off. So I'm not entirely certain of the answer, but I think it depends on whether they're the people that you're totally laying off are within that unit that you defined to them or not. If they're within that unit, then you've laid them off totally. I think you've probably violated your shared work program permission, but perhaps you might be able to if they're outside that unit. But honestly, I'll say I don't actually know the answer to that. I'm just kind of spitballing it here, but I'm pretty sure that not within the unit, but perhaps outside the unit. And the thing you could do is either contact the Department of Labor and give them a hypothetical that that's what you might be planning to do rather than identifying your name so that you remain anonymous in requesting this information. Or you can always have your lawyer contact them as well.
This is Vaughn, a question for you again. Is documentation required for both the new sick leave and FMLA for the tax credits or just the FMLA?
Okay, you kind of faded out there, but I think the question is the documentation that's necessary to get the leave the same as the documentation to get your IRS tax credit? That's actually something that our employment law team discussed just this morning. And in fact, there is a lower threshold for the employee to get, at least as set forth in the act and the regulations, to get that leave than what the IRS requests. But the regulations specify that the employer can ask for from the employee what the IRS requires to get the tax credit. So if you just read the act and the regulations, it would look like you don't get to ask for all the things that you need to get your IRS tax credit, but in fact you can. So what you'll need to do is look at the IRS tax credit information and make sure you're getting all that from the employee.
Another Vaughn question. Do the 80 hours of part-time count as part of an employee's 12 weeks of FMLA for an organization who is claiming an exemption of the 10 weeks of FMLA childcare?
Sorry, read that one back to me again. I'm having trouble following that one.
Do the 80 hours of paid time count as part of an employee's 12 weeks of FMLA for an organization who is claiming an exemption of the 10 weeks of FMLA childcare?
The question I'm answering is, does the 80 hours emergency paid sick leave, is that overlapped by, and can you count that towards the 10 weeks of your paid emergency family and medical leave act leave? And the answer is no. They're two separate things, and you don't get a double count though.
This is an Andy question. Does the CARES Act apply to nonprofits?
So as it relates to the Payroll Protection Act plans, absolutely. As long as you are a 501c or a veterans organization under 501c19, then yes, it does. And 501c3s are generally public charities and religious organizations.
Okay. And I believe the next question, Andy, you also answered as part of this, but just in case, is the amount of a loan that is forgiven under the Act taxable under the forgiveness of indebtedness income provision of the Internal Revenue Code?
It is not. The CARES Act includes a specific provision that says the amount of the loan that's forgiven under the Payroll Protection Plan will not be taxed as income.
All right. I am going to make this the last question, unfortunately, and I know that there are a number of additional questions that I will not get to, but we are at the end of our allotted time frame. Whose decision is it for an employee who pursues unemployment compensation? Is it the employees or the employer through the FFCRA and the EFML? Need to unmute Vaughn, I think.
So I think that's a question for me. It's the same answer as under traditional unemployment. The unemployment, the expanded unemployment under these acts doesn't change the underlying eligibility criteria for unemployment. It simply provides that if an individual qualifies for unemployment under the traditional tests, then they can get it for a longer period of time and they can get that extra $600. But in terms of whether an employee can say, well, I'm entitled to unemployment because of COVID-19, if it's not going to meet the usual tests, then, and they're not eligible for unemployment, they're not eligible to have it expanded or an increased amount because they're not eligible in the first place. Now, I might just point out, I read that we had last week, we had, I think, 22,000 or 23,000 unemployment claims in the state of Kansas. This week we doubled it. And I think nationally in the last week or two, we've had something like 7 million. I think we had 3.5 million last week and 7 million this week. Simply because all these people have applied for unemployment does not necessarily mean that they are all going to be deemed eligible for employment. So I don't know what the percentage is going to be, but there's probably a lot more people applying for it now with these augmented time and the augmented amounts. But a lot of those folks are probably not ultimately going to be found eligible for unemployment. Just add that in as a parting shot.
Kind of as a last item, we will get back to you as to how we will get these slides to you, either the chamber or us. Somebody will be in contact with you about getting those slides to you after that correction has been made. And once again, thank you to the chamber for inviting us. I hope this has been of some benefit. I know we didn't get to all the questions, and that's the nature of these things. We never do. But I very much appreciate the opportunity to provide this information to all of you. And Tracy, I guess I'll turn it over to you to wrap it up. Thank you very much.
Great. Thank you, Tony, and to Vaughn, Andy, and Alex. We very much appreciate your expertise and the time this morning that you took to share with all of our businesses across the metro and wherever everyone was dialing in this morning. There was certainly a lot to unpack and a lot to understand with these regulations, some that went into effect yesterday and some that are rolling in over the next week or so. We thank you for joining us this morning. We know there were a few technical difficulties with some of the registrants not being able to dial in, and we'll have this up on our website, opchamber.org, very shortly with both the recording and the slides. So if you know someone who wanted to listen and take part this morning, let them know that we will have this up very, very shortly. Thank you again for joining us, and thanks again to our partners at Foulston Siefkin. We are adjourned.